Hello everyone, my name is Abby Cannon. I'm a paramedic here at Duplin County EMS. Today we're going to go over basic airway maintenance at the EMT basic level. A couple of objectives for this class is going to be to identify patients that need assistance maintaining their airway. Second is going to be proper usage of positioning to maintain airways. Third is proper ventilations using a BVM. And fourth is going to be proper usage of basic airway adjuncts to maintain airways. Let's start with the patent airway. Does your patient have a patent airway? Is your patient sitting up breathing? Is your patient alert oriented to person, place, and time? In other words, are they able to tell you who they are, where they're at, the date, their birth date, that type of thing? What's your patient's work of breathing? Are they breathing too hard? Are they breathing too fast? Are they not breathing enough? Are they not breathing enough times a minute? Are they having retractions around their ribs? Are they a couple of different positions you want to look at? Are they tripoding? Are they sitting on the end of their chair with their arms propped up on their knees, like really taking really hard, deep breaths? The next we want to look at is what's your patient's skin color look like? Is your patient warm, dry, pink? Is their skin blue? Is their skin gray or ashy? Um, what's their cap refill? Do they have good cap refill? You want to look around their mouth, see if you see any kind of cyanosis around their mouth. The next thing we want to look at is abnormal positions. Is your patient sitting in a chair where their airway is open? In other words, are they slumped over in a chair where maybe their chin's down to their chest and their tongue is rolled back in the back of their throat and they're unable to get good airway that way, or good air movement that way. To position and open it, we're going to talk about positioning to open and maintain an airway. Let's first talk about the head tilt chin lift. You can do a head tilt chin lift on medical patients. Anyone that you do not suspect spinal injury on, you want to take and tilt their head back and their chin up to the sky. This will open their airway and remove the tongue from the back of their throat. The next one is a jaw thrust maneuver. You have to do jaw thrust maneuvers on patients that you suspect C-spine injury on. Anyone that you might suspect C-spine injury on, you're going to need to apply a cervical collar to help with positioning so you don't move their neck around a lot. Anyone that you have to do a jaw thrust maneuver on, if you end up having to bag this patient, you're going to need at least 2 people to do this procedure. Next, let's go over the usage of a BVM. A BVM is a bag valve mask. This is something that you can have that you use to assist your patients with breathing for someone that's maybe breathing too fast, not adequately enough, or not breathing at all. A BVM has a mask that's supplied with it. The mask has to be placed with a good seal over the nose and over the chin of the patient's face. You might have some difficulty getting a good seal on patients that have facial hair, or their chin is not very prominent, or if they have dentures, or if they don't have teeth at all. You're going to have a really hard time getting a good seal on these patients. Once you do a head tilt chin lift or a jaw thrust and you apply the BVM mask, you want to make sure you get a good seal when you go to squeeze the bag to help with ventilations or apply ventilations to your patients. Also, these BVMs, they have to be hooked up to supplemental oxygen. It needs to be on at least 15 liters of oxygen when using the BVM to your patients. Like I was saying, you need to get a good mask seal on these patients. You need to squeeze the bag. You do not want to squeeze the bag as hard as you can. You only want to squeeze the bag till you see good chest rise and fall on your patients. Once you see good chest rise and fall on your patients, you want to bag your patients. Adult patients, you need to bag around every 5 to 6 seconds a minute. Pediatric patients, you need to bag around every 3 seconds. Once again, I want to emphasize the importance of not bagging or not squeezing the bag on the BVM as hard as you can. You only want to squeeze the bag just enough so you see good chest rise and fall. Next, let's talk about oropharyngeal airways. This is an oropharyngeal airway. This is used to keep the tongue pushed forward so you can get a good seal with your BVM. The contraindications for these are patients with a gag reflex. If your patient has a gag reflex, you cannot use these. When inserting these, if your patient begins to gag, you need to remove it immediately so they don't vomit and aspirate. These can be these have to be measured. They come in multiple sizes. Like I said, these need to be measured to see what size fits your patient. The way you measure these is these are measured from the earlobe to the corner of the mouth to see what size that you need for your patient. To insert these, you start by facing upward. Once you go to insert it into the mouth, you roll it over and get it behind the tongue. And this part right here rests on the corner of the mouth. Like I said, you can use these while using your BVM, and they help with the ventilations. They help make sure that you're getting adequate ventilations on your patients. Another airway adjunct that we're going to go over is the nasopharyngeal airway. This is a nasopharyngeal airway. Again, once again, they come in multiple different sizes. You also have to measure these just like you do the oropharyngeal airways. The way you measure the nasopharyngeal airways is you measure these from the earlobe to the tip of the nose to see what size you need for your patients. The only contraindication to these is if you think or if you suspect any kind of facial trauma, or if you think your patient may have like a basal skull fracture. These are contraindicated in that. When these first come out, they used to be very hard and not as pliable as they are now, and there was a chance that if your patient had a basal skull fracture that you were going to fracture through or complete the fracture and go into like the patient's brain. But now they're a lot more pliable and a lot softer than what they used to be. If you're going to use these, you're going to need to use some kind of lubrication on them. You're going to want to put them in either Nair, whichever one you want to use. If you go to apply it or to place it into a Nair and you meet resistance, you need to pull out and maybe try the other Nair and see if it'll go in it. There's a beveled end and a spicy and a like a spiked end. The beveled end is what you want to go to the septum part of the nose. So if you're going to start on this side, the bevel end needs to go in, and once you start to put it in, you're going to have to rotate it around, because once you're finished, it should be sitting, this part should be sitting at the base of the nose, and this part is going to go around to the back of the nose to help supply with an airway for your patient. If you have a patient that is having significant airway difficulties or is not breathing at all, you can use both of these, the oropharyngeal and the nasal. You can use both of these as airway adjuncts to help with proper ventilations of your patient. Once you start ventilating your patient, you want to recheck skin signs. You want to see if they're pinkening up, if their skin's getting pink, if their skin's still warm and dry. You want to check for cap refill. You may want to place your patients on capnography. You can place your patients on capnography, which can only be read by paramedics, but you can place your patients on capnography with the NPA in or the OPA in to see what kind of readings you have, or you can check like I said, you can just check skin signs, mentation of the patient. You need to check for the heart rate, make sure all the vital signs are picking up according to what the patient's vital signs need to be. I think that about concludes the class. Thank you.